High reliability is a relatively new idea for healthcare. What it means is to aim for a goal of zero harm for patients and healthcare workers. And getting there is going to be quite a challenge for healthcare because there is no healthcare system that produces high reliability. The clinical transformation that's necessary is to stop achieving improvement in quality one project at a time, but rather, like high reliability organizations in other industries, make zero harm a natural byproduct of the way we take care of patients every day. Getting there and achieving a positive return on investment is even more challenging, and that requires the use of new, at least new to healthcare, improvement tools like Lean, Six Sigma, and change management. Because what we found is that while clinical processes benefit enormously from the application of these tools, so do business processes, supply chain, throughput, revenue cycle, all have tremendous opportunities for improvement to generate a positive return on investment while these tools are helping the organization transform its clinical care. The obstacles for healthcare organizations to get there are many. First of all, there are no examples. Nowhere in the world does high reliability healthcare exist. So what healthcare needs to do is three things. First, the leadership of the organization needs to commit to the ultimate goal of getting to zero harm. And leadership means the board of trustees, management, physician leaders, nurse leaders, formal leaders, informal leaders, and very often that's the hardest obstacle to get over first. The idea that we can actually get to zero harm. But now there are more and more healthcare organizations that have committed to the goal, that have been working toward it for a number of years, and are starting to demonstrate that zero is possible. And you can get there by also generating a positive return on the investment. So it's a win-win-win for everybody. The idea comes from other industries like aviation, nuclear power, even amusement parks, where zero harm is not the result of 150 safety projects going on simultaneously, but rather it's the result of the way they do their business every day. And that's the transformation that we're really aiming at in this move to high reliability healthcare for healthcare organizations to undergo, to get to a place where zero harm is the natural byproduct of the way we take care of patients. And this is first of all about a leadership commitment to getting there, to starting on this journey, and it's also about the culture of the organization. In high reliability organizations, everyone who works in that organization, whether it's an aviation industry organization, nuclear power, and the military has plenty of examples on aircraft carriers and other places, everyone is always looking for the smallest thing that might be off, a little bit off, that would indicate that a safety process isn't working right and that needs immediate attention. Everyone knows that their primary job is about safety and quality. And that's the kind of culture that we need to have in healthcare. Overcoming the intimidating and disrespectful behaviors, the lack of really sound accountability systems so that everyone is accountable for consistently adhering to safe practices. Those are some of the barriers that healthcare faces, but we've got lots of good examples from high reliability organizations in other industries to guide us.